So stereotaxic surgery involves, affixing what they call a stereotaxic device, which fixes the head in place, whether it's, let's say, a rodent, if you're going to be doing sort of rat surgery or mouse surgery. For the implant, or actually in humans too, it's used clinically to descend, for example, deep brain stimulating electrodes for Parkinson's disease. But basically, the stereotaxic device fixes the head in place for the implantation of what's called a cannula, which is like a tiny little tube through which chemicals can be administered, or, for example, an electrode to stimulate, or the cannula can be used actually to measure neurotransmitter release in response to the delivery of drugs through a technique known as microdialysis that we'll talk about in a minute. And there's lots of research and clinical applications for stereotaxic surgery, including lesioning. There's a rodent model of Parkinson's disease. Remember, Parkinson's involves the degeneration of the substantia nigra in the brainstem, which is a significant dopaminergic projection source for the release of dopamine in the dorsal striatum. Remember, parts of the basal ganglia that are critical for the initiation of movement, the stopping of movement, the timing of movement. And what they'll do is they'll implant a cannula and deliver something called 6-hydroxydopamine into one side, and damage that substantia nigra. That 6-hydroxydopamine is a kind of free radical that'll damage the dopaminergic projections from the substantia nigra, and the animal will actually start to rotate because the timing is off on the right and left basal ganglia. And so that's used as a model, for example, of Parkinson's disease. In order to identify where, you're going to be, drilling and then, delivering the cannula or the electrode into the brain. For rodent surgeries, rodent stereotaxis, they typically consult a rodent brain atlas. So there's an atlas of your standard rodent, and it'll give you coordinates. And this is not a rodent, this is a human skull, but I wanted to show you actually some of the features here. This is an individual who had brain surgery. So there are these really remarkable kinds of titanium clips that were left in to reattach the bone fragment. And there's even like these little holes you can see here through which they had to stitch the dura mater, the top layer of the meninges underneath, to the surface so that blood or fluid wouldn't pool there. But it's kind of faint to see. But let's see, if you look right along here, you can see these it looks like a little EEG tracing here. This is called the coronal suture, where this frontal bone sort of fused back here to the other bones, and then along here is what we call the sagittal suture, and where they come together is a point called bregma, and usually they're giving you coordinates based off of that sort of skull landmark, bony landmark on the dorsal surface of the skull. For humans, of course, they don't just use bregma; they actually do significant imaging of your own brain, so they have a more precise understanding of exactly where they're trying to, for example, descend down a deep brain, electrode stimulator to help with Parkinson's disease, for example. But with animals, with rodents, they tend to just use an atlas, and then afterwards they've got to actually slice and look and make sure that they actually delivered, the cannula or the electrode into the right location. They've got to sort of confirm that after the fact. But stereotaxic surgery is a very, common technique in, examining, the brain's response to drugs, obviously, because they have to deliver drugs often to specific portions of the brain. And by, performing this kind of surgery and delivering the drugs through, let's say, a cannula directly to a specific location, they can sort of see what the role of that particular location is in response